I want to talk to you about hair repair. That is, correction of previous bad hair transplantation. It's a subject that's very important to me because I think that in the past era of bad hair transplantations, when plugs or larger grafts were being used, when there was no aesthetic design, when hair was being transplanted, that it's really scared away a lot of potential patients who just say, you know what, I don't want to have a natural result. And I can tell you one thing, I don't either. If I were doing unnatural results, I wouldn't be in this business and I wouldn't even want to be doing what I'm doing. The difference is that those days are really gone. And for the most part, the surgeons that were using that technique really have stopped using the technique. So I want you to feel much more comfortable that the techniques we have today are very different. Some of the subtleties that I've gone through in terms of our techniques that make us different and also make us allow us to provide really natural rejuvenation, I've already gone over in our general hair restoration video. In this video, I want you to understand some of the principles of how we work on getting a bad hairline or a bad previous work corrected. Let's start with the hairline. The hairline, what I see oftentimes that looks unnatural, when you look across the room you go, my goodness, that hairline doesn't look natural, are several fold. And it really begins with the idea of understanding artistry. If you look at a hairline, if it's too straight, that's unnatural. I create a macro and micro wavy pattern that's almost irregularized. It is irregularized so that that hairline looks very natural and you don't see it. And I use tiny grafts as I sweep backwards. So if you've got too straight a hairline, part of what I'm trying to do is take that straight hairline and irregularize it so you can't see it. If the grafts are too large for the central hairline, my goal is to camouflage it through a process called de-emphasized grafting, where I use finer grafts that are better angled, better positioned, and hopefully placed in front of the grafts to create a wall so that you actually use those old plugs as to provide me density, but I really camouflage it all the way around so you don't see it, and I still take advantage of it. If your hairline is too low or poorly designed, then sometimes I've got to take a little strip of skin where I do recycle, hopefully, a large component of those plugs, but bring the hairline back to a natural position and then draw that hairline out with the finer grafts, which is important. Some of the other things that I see that are out there in terms of helping patients is donor scars. When donor scars are too wide, sometimes you need to actually graft into the donor scar, and that's an important attribute of fixing things. I really am very proud of my work, and a good percentage of what we do is correcting hairlines, correcting malpositioned and poorly placed grafts that are too large. And obviously it's very hard to sort of encapsulate all the various techniques that we use and employ in our practice to correct hair because there's so many diverse problems with older techniques. I really look forward to meeting you and talking to you and trying to help figure out exactly how we can correct your hair problem if you've had a previous procedure that wasn't as good as you had expected it to be.